Welcome back to Daily Health Advice, where we take the time to truly listen to our bodies and face the things that may seem small or private, yet are incredibly important. Because sometimes, if no one speaks up about certain issues, no one will ever truly understand or care about them. Especially after the age of 60, the body no longer stays silent like it used to. It begins to speak, not loudly, not dramatically, but with gentle knocks. Sometimes it's just waking up in the middle of the night, a bit of trouble urinating, or a wave of fatigue that comes without reason. But if we ignore these signs, the price we pay can sometimes be far greater than we imagine. Today, I want to share with you a topic that many people might hesitate to talk about, something that may feel too private or uncomfortable to bring up. But please, stay with me until the end of this video, because I truly believe what I'm about to share could completely transform the quality of life for any man in his later years in a way that's natural, approachable, and most importantly, doesn't involve medication. As a urologist for over 30 years now, I've often asked my patients a very simple question. How many times did you get up to urinate last night? It may sound like an ordinary question, but to me, it's the key that unlocks so much more. Some people chuckle and say, "Twice, but I'm used to it now. I can go back to sleep." Others sigh, 4 or 5 times. "I can't sleep at all, doctor." And then there are those who say nothing at all, just bow their heads in silence, because they know this isn't just about urination. It's about a long, quiet struggle that drains their sleep, their spirit, and their health. I understand that feeling. Because the prostate, that distant-sounding name, actually plays a deeply personal role in the daily lives of older men. It affects urination, erectile function, sleep quality, and even a man's confidence in his intimate relationship. When the prostate has issues, it's not just the body that grows tired. The spirit suffers too. What's dangerous is that the early signs are often very subtle. So subtle that most people brush them off. They assume, well, I'm getting older, that's just how it is. Or they feel embarrassed, ashamed. But it's that very silence that pushes us further down the path of illness. I'm not saying this to scare anyone. I'm saying it to remind you of one thing. The problem isn't your age. The real issue is whether or not you're listening to your body and whether you take action in time. Before we get into how to improve things through simple, easy, private steps that don't require medication, I'd like to invite you to take a closer look with me at the subtle but clear signals your body has been quietly sending every day. My name is Dr. Tran Minh Thanh. I'm 67 years old, and I specialize in urology. After nearly 40 years in the field, perhaps the thing I've heard most from elderly men isn't complaints, but silence. A kind of silence born from endurance. Many come into the clinic just to have their blood pressure checked. But after a few more questions, I often learn that they've been getting up to urinate 3 to 5 times a night, barely sleeping, and waking up completely drained. Some tell me they stand there for 10 minutes, only able to release a weak dribble. Others quietly admit that they haven't felt a morning erection in over a month, but haven't dared tell anyone, not even their wife. And some just sit there, lost in thought, saying they've been avoiding going out lately because their underwear is constantly damp, and they no longer feel confident like they used to. These aren't the kinds of things people boast about. But for me, someone who's listened to thousands of stories just like these, I know all too well. These aren't just symptoms. They are cries for help from the body. Quiet, persistent cries. And if we truly listen, there's still time to respond. I know many people think these are just natural signs of aging. You get older, of course things aren't like they used to be. It sounds reasonable, but the truth is far more complex. Yes, aging is natural, but insomnia, frequent nighttime urination, the feeling of not fully emptying the bladder, that lingering burning sensation, and constant fatigue, those aren't just signs of getting old. They are clear indications of underlying health issues. And more importantly, they are signs that the prostate is beginning to deteriorate. Some believe that they just have to endure it a little longer, but it's that very endurance that's turned mild sleep loss into full-blown exhaustion. What starts as discomfort while urinating becomes painful, difficult urination, and before long, it turns into incontinence, the constant fear of an accident, the anxiety of not making it in time. I once had a patient named Mr. 2, 71 years old, from Dong Thap. He came to see me because, as he put it, I can't sleep anymore. I keep having to get up to pee. But after talking more with him, I found out he had quietly endured this for over 2 years. At first, it was just twice a night. Then gradually it became 3, then 4, then 5 times. He was so exhausted that he didn't dare go out to the fields in the morning, afraid that he'd suddenly need to urinate and wouldn't make it in time. As for his intimate life, he simply said, I gave up on it. He no longer felt any desire, and his body always felt drained. What made him saddest wasn't that he couldn't be with his wife. It was the feeling that he wasn't a man anymore. I understood, and I told him the truth. It wasn't age that had taken all of that away. It was his prostate sending clear signals that he hadn't listened to. It's no coincidence that nearly all of Mr. 2's symptoms, and those of hundreds of other patients I've treated, begin with the same signs: frequent nighttime urination, a weak urine stream, the feeling of not fully emptying the bladder, loss of morning erections, and a constant, unexplained fatigue and heaviness in the body. These symptoms can have many causes, but in most cases, especially in men over 60, the culprit lies in a small, familiar organ that often gets overlooked: the prostate. The prostate doesn't enlarge for no reason. It changes due to a combination of circulatory issues, hormonal imbalances, and lifestyle habits. It doesn't scream out like a heart attack or a stroke. It whispers in the quiet moments you wake up at night, in the awkwardness in the bathroom, in the sad glance of a wife when intimacy fades. I'm not telling you this to scare you, but to help you see that the prostate doesn't just get worse because of age. It gets worse when we ignore the signals our bodies are sending us. And to truly understand why this is such an important issue, why this one small gland can affect your sleep, your blood pressure, your mood, even your heart and brain health, we need to take a closer look at how the prostate works, what it does, what it needs, and what happens when it becomes blocked. The prostate, it may sound like a strange, distant term, but it's actually a very familiar and vitally important part of a man's body, especially from middle age onward. It sits at the base of the penis, just below the bladder, surrounding the upper part of the urethra, the tube that carries urine out from the bladder. Though it's small, about the size of a walnut, the prostate is a kind of biological gateway that all urine and semen must pass through. Its main job is to produce part of the semen, not to store it, but to support fertility, circulation, and overall health. But here's something many people overlook. Semen isn't meant to be stored for long periods. It's meant to flow, meant to be released regularly. When we're young, this happens naturally, thanks to sexual activity, hormones, and the smooth operation of the body. But as we age, sexual activity tends to decrease. Embarrassment or self-consciousness sets in. And many men start to forget about that part of themselves. That's when things begin to change. When semen isn't released regularly, it starts to build up in the ducts of the prostate. Little by little, day by day, what was once a strong, steady flow becomes a slow-forming blockage. The body reacts with inflammation. Inflammation causes swelling, and swelling leads the prostate to enlarge, putting pressure on the urethra, making urination difficult, painful, weak, and frequent, yet never quite satisfying. And that's not all. When the blockage persists, it starts to affect a man's ability to achieve and maintain an erection. Blood flow to the genital area becomes restricted. The morning signal disappears, the nights are broken by repeated trips to the bathroom, the body grows weary, and the mind sinks into despair. Many older men have told me they no longer feel like a man, and that kind of pain cuts deeper than any physical ache. I've read countless medical studies from the US, Japan, and Europe, and they all point to the same conclusion. Men who maintain regular ejaculation, at least twice a week, significantly reduce their risk of prostate issues, ranging from chronic inflammation to benign enlargement. This isn't just an emotional recommendation, it's the result of decades of scientific research. One American study involving thousands of men aged 45 to 75 showed that those with consistent ejaculation habits were not only less likely to suffer from prostatitis, but also had a notably lower risk of developing prostate cancer compared to those who had little or no sexual activity. Scientists explain this using a simple yet powerful concept: circulation and elimination. Just like a stream becomes cloudy if it stops flowing, but stays clear and fresh when it's constantly renewed, the same principle applies to the male reproductive system. The unfortunate truth is, once men reach their 60s, many forget or shy away from this important part of their health. Some live alone, without a partner. Others live with children or grandchildren and lack privacy. Some simply think, I'm old now, what's the point? And just like that, the body is left to accumulate, clog, age, and weaken, bit by bit. I'm not sharing this to worry you, but to emphasize one vital point. The health of your prostate isn't determined by pills or surgery. It lies in whether or not you allow your body's natural flow to continue, whether or not you give your body a chance to function the way it was designed to. And if you still think this is all just theory from textbooks, then please listen to the following story, a true story, unedited and unembellished, about a man in his 70s who suffered from sleepless nights and even urinated blood due to a blocked prostate, yet managed to turn everything around with one small action each night. I remember him clearly. His name was Levon Tom. He was 73 at the time, thin, walked slowly, and always had a weary look in his eyes. He told me, "Doctor, I don't need anything fancy. I just want to sleep through the night without getting up to pee over and over." At first, I thought it was just typical nighttime urination due to age. But after a thorough exam, I discovered his prostate had enlarged significantly, compressing his urinary tract and weakening his urine stream. Then one night, he got up for the 4th time to use the bathroom. As he shuffled down the dark hallway, his foot caught on a small rug. He lost his balance and fell. The result? A fractured hip. He had to be hospitalized for surgery and stayed nearly a month for recovery. The total cost was over 48 million VND, and the root cause was something that seemed so small, getting up too often in the night to urinate. I couldn't stop thinking about Mr. Tom's case, because if he had understood the importance of prostate care sooner, maybe he wouldn't have suffered that painful fracture, wouldn't have been hospitalized, wouldn't have felt so helpless. Another case was Mr. Tran Minh Thanh, 76, from Hue. He didn't come to me because of nighttime urination, but because of chronic back pain that had lasted more than 10 years. Every morning, he said, felt like waking up with a boulder on his back. Just sitting up was a struggle, and standing was even harder. When I asked more questions, I discovered he, too, had all the telltale signs of prostate enlargement, difficulty urinating, a weak stream, and no more morning erections. I guided him through a very simple method. No medication, no cost, just 10 minutes each evening, right after bathing in a private space. At first, he was hesitant. He said, "I'm old already, why bother with that sort of thing anymore?" But he gave it a try. And the miracle was, after 2 months, he called me, excitement in his voice. "Doctor, I feel lighter all over. I sleep deeper. I wake up clear-headed, and I even have morning erections again. My wife thought I'd been taking some kind of supplement." I was happy for Mr. Nam, but also saddened. Saddened that something so simple had been forgotten for so many years. Saddened that so many older men like Mr. Nam and Mr. Tom have endured in silence for so long because of embarrassment or the belief that this is a sensitive matter or no longer appropriate at our age. But what I really want to say is this: as long as your body still functions, still sends out signals, it means you still have a chance to improve. The issue isn't how old you are, but whether you're willing to understand your body and take the right action. And the good news is, what I'm about to share next doesn't require a prescription, a hospital visit, or any financial burden. All it takes is for each of us, whether living with a spouse or alone, to make the choice to begin. Today, at home, alone, in private, gently and effectively. This method isn't far-fetched, nor is it complicated. It's a very simple act, but if done regularly, at the right time and in the right way, it not only supports a healthier prostate, but also improves sleep, mood, blood pressure, and overall quality of life. So, what is this method? How is it done? How long does it take to see results? I'll explain it clearly right now, and I hope you'll listen closely and be ready to give it a try starting tonight. As I've said, the prostate is not designed to store and accumulate. The seminal fluid it produces needs to flow, to be released. Just like a stream must keep running to remain clean and clear. When we're young, this happens naturally. But with age, especially when intimacy declines, when one lives alone, or when age-related embarrassment takes over, that flow stops. And that's where so many problems begin. So the simplest, most natural, and most effective solution is to keep that flow going. Whether through intimacy with a partner or through self-stimulation, the form doesn't matter. What matters is maintaining that natural biological rhythm. Some still carry a sense of shame around the idea of self-release. But please remember, this is not something wrong or immoral. It's a physiological exercise, a way of caring for your body, completely healthy and backed by global medical research and recommendations. The best time to do this is right after an evening shower. At that moment, your body is warm, blood vessels are dilated, your mind is relaxed, and circulation is flowing well. This creates the perfect conditions to gently stimulate the prostate. Many people I've guided have told me that just choosing the right time made the experience much more comfortable than trying to force it or rush through it. The space is important too. Choose a quiet, private area, like your bathroom or bedroom, where you can fully relax your body and mind. Avoid being interrupted or distracted by noise or the presence of others. This is your time, a time to listen, to care, and to reconnect with your body. As for posture, choose whatever feels most comfortable. Some prefer sitting at an angle on a chair, some lie on their side in bed, others raise their legs while seated after bathing. If you have joint issues, back pain, or knee problems, lying down is the safest and most comfortable option. The key is not to force anything, but to be patient, gentle, and slow. One thing I always emphasize to my patients is this: don't just go through the motions. Stimulation must be done with focus and understanding. Start by gently stroking along the shaft of the penis. Don't rush. Don't be rough. Once you're comfortable, pay attention to the base area, the region near the perineum, between the scrotum and the anus. This is a crucial area as it directly relates to blood flow and urinary control. While doing this, if you feel you're approaching climax, try pausing briefly, then continuing. This pause acts like strength training. It helps activate the pelvic floor muscles, enhances ejaculation control, and improves the elasticity of the muscles involved in both urination and sexual function. You can use a little coconut oil or medical-grade lubricant if your skin feels dry. Avoid soap as it can cause irritation and dryness in sensitive areas. Each session should last around 10 to 15 minutes, and doing it 2 to 3 times a week is ideal. What matters most is not the number of times, but consistency and patience. At first, some may feel unsure or even skeptical. Can something this simple really work? But please, be patient. Give your body time to adjust to reset its natural rhythm. Because the true effect of this method doesn't lie in a single night. It lies in the gradual, cumulative transformation from within. After just 2 weeks, many have shared that they sleep more soundly with fewer nighttime awakenings. After a month, urination feels smoother, lighter, and fatigue decreases. And notably, after 2 to 3 months, they begin to notice remarkable changes. Waking up refreshed, feeling mentally clear, even feeling as though they've grown younger by a few years. The most beautiful part is, none of these results came from a pill or a surgery. They came from your own hands, your own initiative, and your own awareness of your body. And this is just the beginning. When the prostate is cared for properly, a ripple of positive changes quietly begins throughout the body, from cardiovascular function to immune strength to memory and mood. That's why I call this a comprehensive solution, not just for one organ, but for the whole internal system of health. So what exactly are these benefits? How can just one small weekly action affect your sleep, your heart, your kidneys, your brain, and your overall joy in aging? Let's continue now into the next part, where I'll explain these positive outcomes more clearly and scientifically than ever before. If you begin applying this method regularly, 2 to 3 times per week, staying consistent for at least 2 weeks, then the first thing you'll likely notice won't be anything grand. It might simply be a deeper night's sleep or not waking up as often to urinate. But even that small change can make a big difference, starting your day feeling lighter, more alert, and less mentally worn down. Many people, after just 2 weeks, realize they're no longer getting up so frequently at night. Each urination feels more complete, the stream is stronger, no more dribbling or pressure, And one seemingly small thing, yet deeply meaningful. Waking up in the morning with a natural erection, an unspoken signal that vitality is returning, that the body isn't nearly as old as we might have thought. When you keep up this routine through the first and second month, the benefits begin to spread to other systems in the body. First, the cardiovascular system. You might not even notice it, but stimulating the prostate correctly boosts blood circulation in the pelvic region, a place often slowed down by aging. Once circulation is activated, the heart works more efficiently, blood flows to the brain more consistently. As a result, the whole body feels rejuvenated. Your skin takes on a healthy glow, your face brightens, your steps feel steadier. Next is the nervous system. During ejaculation, the brain releases a cascade of feel-good hormones, dopamine, oxytocin, and endorphins. These chemicals don't just bring pleasure and relaxation, they also lower levels of the stress hormone cortisol, one of the leading causes of weakened immunity, insomnia, and mild depression in older adults. Many elderly men who follow this method have told me, "I feel different now, less irritable, less anxious, clearer in the head, and I can talk to my children and grandchildren with much more ease than before." Another change comes from the immune system. Few people realize that the prostate, often thought of as just a private organ, actually plays a part in the body's ability to fight off illness. When semen no longer stagnates, when the biological flow is restored, immune cells like white blood cells and T lymphocytes work more efficiently. Some studies have shown that regular ejaculation improves lymphatic circulation, the body's natural detox pathway, helping to reduce chronic inflammation and naturally support disease prevention. There's yet another benefit worth mentioning: improvement in the lower back, pelvic area, and pelvic floor muscles. During ejaculation, these muscle groups contract rhythmically, like a gentle workout. This natural, consistent contraction strengthens and loosens the muscles, helping those who suffer from incontinence, lower back weakness, or trouble walking. One patient told me, "I used to get back pain just from standing to wash my face. Now I move more freely, must be thanks to the exercise you recommended." So when we look at the bigger picture, you'll see this isn't just about treating nighttime urination or improving sex drive. This is truly a full-body practice, a small act that affects the heart, the brain, the immune system, digestion, sleep, and even emotional well-being. The more consistently you practice and the more you listen to your body, the more profound the changes will be. From someone living in fatigue, you can become someone who lives with energy, clarity, and most importantly, renewed belief that growing older doesn't mean decline or surrender. With the right approach, even at 60, 70, or 80 years old, your body can still function smoothly, healthily, and with vibrant life. I know some may still feel hesitant. Hesitant because you've never done this before. Hesitant because you live with children or grandchildren and lack privacy. Hesitant because you think, "I'm past that age." But let me say it clearly one more time. What we're talking about here is not just sexual activity. This is healthcare. This is the action of someone who values themselves, who dares to take control of their health before illness takes control of them. And the beauty of it is, no one needs to know. No one needs to see. It's just you and your body quietly changing from the inside out. And if you've already begun to feel some of the benefits, or you're still unsure, wondering whether or not you should try, then please stay for the final part. I'll not only recap the key points, but share a heartfelt message for everyone who's been living in silence, enduring night after night in weariness. Because one small action today could change the rest of your life, and perhaps even inspire someone else to reclaim theirs too. If you've made it this far, I encourage you to ask yourself one serious question: is my health worth more than my embarrassment? It may sound simple, but your answer to that question could shape the quality of the rest of your life. Because this isn't just about biology, it's about dignity. It's about clarity. It's about making a choice as someone who's walked a long road in life and now chooses to care for themselves with intention, wisdom, and self-respect. I won't pretend this is something easy to do right from the start, but I can say this with absolute certainty. If you have the courage to begin, then you are doing the best possible thing for your health. Just 10 minutes each night in a private, quiet space. No one needs to know. No one needs to witness it. Just you, alone with your body, your breath, your health, and the clear sensation of life being awakened from within. And if tomorrow morning you wake up feeling something a little different, your mind lighter, your spirit clearer, your sleep more complete, or perhaps even a subtle sign of vitality you haven't felt in years, don't brush it off. Don't assume it's just a lucky moment. Keep going. Stay consistent, because every great transformation begins with small movements. A good habit doesn't change your life overnight, but when practiced steadily, it creates real, lasting impact. Like drops of water forming a stream, a repeated weekly action can reshape the entire inner workings of your body. I understand, somewhere inside you may still hesitate. You may think, I'm too old, what's the point now? But please remember this, it's not about how long we live, but how we live. Living with strength, with clarity, with independence and joy, that's what's worth holding on to. You've spent your whole life giving, sacrificing for your family, for your children and grandchildren. Now it's time to give something back to yourself, to live with comfort, with peace, and with the quiet pride of knowing I'm taking care of myself, not for anyone else, but for me. If you found this video helpful, I sincerely hope you'll share it with a friend, a relative, anyone who might need it. One click, one message could be the greatest gift you give to someone silently struggling through the night. And if you've already started or are still unsure, let me leave you with just one message. Don't wait until you're lying in a hospital bed to feel regret. Just one small action tonight could change the course of the rest of your life. Don't forget to subscribe to the channel. The health information we share here is completely free, but its value can be priceless if applied at the right time, in the right way. And if you've tried this, if you felt even a little improvement, please leave a comment below the video. Just one line, I've started, or I'll try tonight. One small comment, but it could become a huge source of encouragement for someone else. Who knows? You might be the one who inspires hundreds, even thousands of people to take back their health. People who are waiting for just one spark of hope, one gentle reminder to return to the path of self-care. I wish you strength, peace, and confidence in every choice you make, so that your later years are no longer a slow decline, but a time of fullness, meaning, and truly living.